Good afternoon, everyone. This is Lynette Kraft, ACSM Chief Science Officer, and I'd like to welcome you to the ACSM Brown Bag Series in Science. We're pleased to have Dr. Russ Pate as today's presenter. I will introduce Dr. Pate and then turn the mic over to him for his presentation. If you have questions, and we hope that you do, please type them into the question area on the GoToWebinar screen, and we'll take as many questions as possible following Dr. Pate's presentation. If you have trouble hearing or seeing the webinar today, it's best to log off and then log back into the webinar. Today's webinar is a bit unique in that we asked Dr. Pate to join us today to provide further insight and discussion related to a paper that he recently published in Exercise and Sports Sciences Review. I'll tell you more about that paper following Dr. Pate's presentation in case you haven't had a chance to read that yet. To introduce Dr. Pate, he is a professor in the Department of Exercise Science in the Arnold School of Public Health at the University of South Carolina. He's an exercise physiologist with interest in physical activity and physical fitness in children and the health implications of physical activity. He has published more than 350 scholarly papers and has authored or edited 8 books. His research has been supported by the National Institutes of Health, the U.S. Centers for Disease Control and Prevention, the American Heart Association, and several private foundations and corporations. He has a research team that is currently supported by multiple grants from the NIH and others. He served on the U.S. Dietary Guidelines Advisory Committee, the U.S. Physical Activity Guidelines Advisory Committee, and an Institute of Medicine panel that developed guidelines on prevention of childhood obesity. He currently serves as chair of the National Physical Activity Plan Alliance and was a member of the 2017 to 2018 U.S. Physical Activity Guidelines for Americans Advisory Committee. He is also a past president of ACSM. So we welcome Dr. Pate today, and with that, we will turn the presentation over to him and have him unmute his mic, and we'll be ready to go.
Well, thank you so much, Lynette. It really is an honor to be invited to speak with everyone today, and thanks everyone for joining. I'm going to be doing 2 things over the next few minutes. My primary task is to address the topic shown here, which is policy for promotion of physical activity and prevention of obesity in youth, and that'll be my primary focus. I will also, toward the end of my presentation, tell you a little bit about some of my group's research, a specific project that we've been involved in for the last several years. So thanks again for joining. With regard to my primary topic, these are the subtopics I'll be addressing. I'm going to set the context here with a little bit of background, say a bit about the nature of the challenge that I think we face, comment on what the science says about our ability to intervene to promote physical activity in kids. My primary task is going to be to lay out some policies and initiatives that I think would help us address the problem, and then say a bit about how I think we need to organize ourselves to address societal-wide promotion of physical activity in children. So first, the basic background. Lynette mentioned that the 2018 second edition of the Federal Physical Activity Guidelines for Americans was recently released, and in that document, the health benefits of physical activity for kids were summarized, and we have strong evidence that higher levels of activity are associated with better fitness, better bone health, reduced risk for development of overweight and obesity, and at least moderate level evidence for positive associations with cardiometabolic health indicators in young people. Based on that science, we do have in the federal guidelines that are specific to school-age kids. Basically, it says that school-age youth should be active for an hour a day, and within that hour should regularly engage in vigorous intensity physical activity, bone strengthening activity, and muscle strengthening activity. Sadly, we know that most American kids do not meet that guideline. It's roughly 30 or 35% of boys, and about 15% of high school girls self-report that they meet that guideline. So most, would report that they do not meet the guideline. And if we measure physical activity objectively with accelerometry, Fitbit-like devices, it's an even smaller percentage of young people in our society that meet that 1 hour a day physical activity target. So it appears there's a problem, and a substantial one that we need to address. So I think it's important to, as we move forward trying to address this issue, to have some understanding of the nature of the challenge that we face, and it's substantial. We know that kids today grow up in a world that's very different than the world that their parents and grandparents grew up in, and it's one that is just saturated with electronic devices and forms of entertainment. And you can see on the right that if we cumulatively look at the overall exposure of kids to these electronic forms of media, it's a huge fraction of their daily time that kids spend in front of these devices. And it may be counterintuitively, as the type and number of these devices has expanded, TV watching time, which we've known for quite a while is potentially problematic, hasn't decreased as participation in these other forms of electronic entertainment has expanded. And at the same time that we've presented kids with a lot of sedentary distractors, we've also removed the demand for physical activity in many parts of our lives. And this figure shows what's happened over a period of 40 years or so with active transport to school. And you can see that the percentage of kids that walk or bike to school has decreased precipitously, and the percentage of kids that get to school by personal automobile transport has increased dramatically. So what was at one time a very important source of physical activity for millions of kids in our society is no longer nearly as prevalent a form of physical activity. So what can we do about it? And is there evidence that we can successfully intervene to change kids' physical activity? And I think the answer is yes. And this question has been addressed by a number of expert groups, one of which was the expert panel that came together to produce Physical Activity Guidelines Midcourse report that was released in 2013. It reviewed interventions to promote physical activity in several different settings, including schools. And reviewing all of that literature concluded that multi-component school-based interventions and modifications to school physical education programs clearly work, and that there's sufficient evidence to suggest those should be widely implemented in our society. For many of the other settings in which activity can be promoted in kids, the evidence is still emerging or limited at this point. And that's largely because there are relatively few studies that have addressed these approaches, and I think we'll hopefully know more as the research develops over time about how we can successfully intervene. But there certainly is growing science and increasing clarity that it is possible to increase physical activity in kids by intervening in the settings in which they spend substantial time. The Community Guide to Preventive Services, a very authoritative public health document. It lists a number of approaches to promoting physical activity that are known to be effective, and several of those I think are particularly relevant for children and youth. Family-based interventions have been shown to work. As I've mentioned, enhanced school-based physical education interventions. Creating and improving spaces for physical activity, which clearly apply to kids, and community-wide campaigns, one of which, called the VERB campaign, was undertaken some years ago and targeted children and was shown to be effective on a very large scale. So there are approaches to promoting physical activity that the science indicates are effective. And within the context of the physical activity guidelines process that was just completed a few months ago, interventions to promote physical activity in kids were considered. Youth-oriented interventions, particularly those undertaken in the family environment, were shown strongly in the science to be effective. Also rated as strong, the evidence was rated as strong for school-based interventions aimed at increasing activity in kids. So we do have approaches that have been tried and tested and shown to be effective. So my primary purpose here today is to lay out quickly a number of initiatives that can address this problem by launching large-scale public health efforts in our nation. And I'm going to outline what I think those are, and then say something about how I think we can kind of package all this in a large-scale public health initiative. So the first one I'll mention is establishing the comprehensive school physical activity model in schools across our nation. I've mentioned that previous science has shown that these approaches are effective. The comprehensive school physical activity model certainly includes enhanced physical education, but also includes physical activity programs before and after school, physical activity programs during the school day, classroom exercise breaks, recess breaks, and so on, and then also connections between school and community resources. So this model's been shown to work. We need to expand its reach in our society. And fortunately, the Centers for Disease Control and Prevention has an initiative that's aimed at better establishing this comprehensive school physical activity model, and is working in a number of states right now to accomplish that. Shape America, which is the professional society for physical education and health education teachers in the schools, also has an initiative that's aimed at better establishing this comprehensive school physical activity model. Second, within that context, we need, I think, to demand high-quality physical education. Physical education is a well-established institution in our society. We've known in the science for many years that it's possible to change instructional practices in physical education in ways that result in kids being more physically active while they're in PE classes. We need to better establish those approaches in physical education programs across the nation, and there certainly are strategies that have been shown to be effective in accomplishing that. Next, we know that even our youngest children are not as active as they used to be, and because of that, we have higher rates of overweight and obesity in very young children in this country. I think we need to require physical activity in early child care and education programs. This too has been studied. Unfortunately, my group I'll tell you more about our work in preschools and child care centers in a little while here, but we do know that kids, even young kids, tend to be sedentary much of the time that they're in the preschool setting. But we do know that it's possible to change that, and I'm excited that the recently released second edition of the Federal Physical Activity Guidelines does include recommendations for preschool age kids. Basically says kids should be active throughout the day. The caregivers should promote activity in young children, and that a reasonable target is that kids should be active for at least 3 hours a day. That's inclusive of light, moderate, and vigorous intensity activity. And there is encouragement that there is positive change in preschools and child care centers across the country. Many states are adopting obesity prevention policies that are incorporated into licensing of child care centers, and many states have, in the last 5 or so years, adopted new policies aimed at ensuring that young children will be physically active while they're in formal child care centers. Next, I think we need to require physical activity in after-school programs. This is a very mixed bag right now. There certainly are after-school programs that do provide meaningful amounts of physical activity, but there are many that do not, and that basically warehouse kids and maybe try to make sure they get their homework done. But I think intuitively many of us believe that during this after-school period, kids really should be physically active, and it's been shown that it's possible to modify how after-school programs operate to, as shown here, produce meaningful increases in the time that kids spend being physically active while in these programs. And I'm pleased that the YMCA of America, which is a very large provider of after-school programming in the U.S., has, over the last few years, adopted new policies aimed at ensuring that kids will get at least 30 minutes of physical activity during their time in the after-school programs that are delivered by the Y in communities across the country. Next, I think we need to create equity and community resources that support physical activity. We know that activity levels of kids is influenced by the built environment in which their neighborhoods are situated. We know that kids that live proximal to positive resources tend to be more physically active than kids who don't. And that argues that we need to have appropriate, equitable resources for all kids in our communities. And an example of a group that addresses this is the City Project in Southern California in the Los Angeles area, where this group brings legal action against cities and counties that are not providing equitable resources. And I think we need that strategy, I think, needs to be more broadly applied across the country. Many millions of kids engage in youth sport programs, and I think we need to ensure that they're as physically active as possible when they're in those programs. Again, it's been demonstrated that there's a lot of variability in how much activity kids get when they're in the youth sport setting. That varies with the sport, and it varies with the nature of the adult supervision that is provided while kids are engaged in these programs. And we know that we can modify the way those programs operate so that kids get more activity while they're there, and we should do that. And we know it matters. We know that kids who are engaged in youth sport programs tend to be more active than kids who are not, and that kids who are engaged in youth sport programs that deliver a lot of activity are more active overall than kids who are engaged in programs where the activity requirement is lower. The Aspen Institute a few years ago launched an initiative called Project Play, which is aimed at enhancing the overall quality and exposure of American kids to appropriate youth sport programs. And if you're interested in this particular issue, I encourage you to go to the Project Play website and take a look at what they're supporting. I've mentioned the importance of active transport to school, and I think we've got to do everything we can to renormalize that behavior in our society. It was the social norm at one time. It no longer is the social norm, but we've got to do what we can to reestablish it as the norm. And lots of studies have been done looking at how many kids get to school by active means, walking or cycling. And sadly, it's not many. As shown here, the largest percentage of schools are those in which fewer than 10% of the kids get to school by active means. So we've got a long ways to go here before we reestablish this behavior as the norm. But when we do, it's going to matter because kids that regularly walk or ride bike to school are more active than kids who do not. And I'm pleased that we do have a federal initiative that's aimed at supporting active transport for kids. It's the Safe Routes to School program, which operates under the auspices of the U.S. Department of Transportation. And I certainly think we need to expand this initiative to the greatest extent possible. We need, I think, to institutionalize clinic-based physical activity assessment and counseling for kids and, frankly, for everybody else as well. And we know that, there are lots of barriers to healthcare providers, kind of expanding their portfolio of activities, but given the important impact of physical activity on health and the concerns about declining activity in our society, clearly many think it's, and I'm one of them, think it's very important that we institutionalize physical activity counseling and assessment in the clinical environment, including pediatrics practices. And of course, ACSM and partners have been pursuing this aggressively under the auspices of the Exercises Medicine Initiative for a number of years now, and great inroads are being made, and I think we need to support that. In this case, particularly in the family practice and pediatric practice settings. There are nice models out there. One of them is the Intermountain Healthcare system in the Salt Lake area, where they really have embraced this approach with their work with children and adolescents that come through their clinics. And I think we need to build activity-friendly home environments. This one's not going to be easy to come at from a public health standpoint, but I think we need to do everything we possibly can, because it's self-evident that parents and the home environment have a huge impact on kids' activity levels. The good news is most parents seem to understand that this is an issue, and most parents indicate that they do take action to support their kids' physical activity. But I think the bottom line is, we have a lot of progress to make in this area. Kids used to be very active in and around the home, and probably are less so now than they used to be. Kids need to spend more time outside while they're in the home environment, and while they're, I certainly understand that there are safety concerns that we need to address. Not by any means saying we should ignore those. It is nonetheless true that millions and millions of American kids can safely be outside in their neighborhoods and need to spend more time outside being active and less time inside in front of a screen. The Y, again, does have an initiative that's aimed at working with parents and modifying the home environment. So those are the things I think we should be doing. The question now is, what's it going to take to get these in place? And I think it's the answer is apply proven public health strategies. Our society has had some real successes in other public health areas, and I think we need to apply those approaches to this issue. And so we do need federal leadership. We certainly have some federal agencies that work in this area. I think as citizens and taxpayers, we need to support increasing the resources that these federal entities have to apply to this particular issue, so that the federal leadership can be more effective and expansive. We need a plan, and we do have a comprehensive strategic plan for increasing physical activity in the U.S. It's called the National Physical Activity Plan. It includes 250 strategies and tactics that have been identified as evidence-based approaches to promoting physical activity. The plan is organized around 9 societal sectors, each of those sectors represented by expert panels. And I will mention before I move on that ACSM has been tremendously supportive of the National Physical Activity Plan, along with a number of other national not-for-profit health organizations that have been engaged with this project for the last decade. We need better surveillance. We need to monitor not only how active kids are, but we need to be able to better monitor the services and programs and initiatives that are available in communities across the country. And one of the core public health functions is surveillance, monitoring of where we are with with physical activity behavior in different segments of the population, but also the status of our communities in supporting physical activity for children and youth. We need ongoing evaluation. The National Physical Activity Plan on a 2-year revision cycle does produce a U.S. report card on physical activity for children and youth, and that's an ongoing effort. So that brings me to a transition point here. So I'm at this point, as I mentioned, I was asked to say something about my own research group's work, and so I'm going to quickly tell you a little bit about a series of projects that relate to a particular issue that we've been interested in, and that is promotion of physical activity in young children through strategies applied in the preschool childcare setting. And we've undertaken a series of projects in this setting that have resulted in translation of research to practice that I'll tell you about. This is the group I work with every day that has contributed to this work and made it possible for us to accomplish what we've been able to accomplish in this area. Our group is particularly interested in interventions to increase physical activity in young people. I'll story with a National Institute of Health funded randomized clinical trial that we call SHAPES, Study of Health and Activity in Preschool Environments. The purpose was to observe the effects of a multi-component intervention in preschools on children's physical activity levels. The components included what we call Move Inside. That would be initiatives aimed at kids being more active in the classroom. Move Outside, increasing their activity when they're outside in a play space. And then Moving to Learn, which involves incorporation of physically active teaching learning strategies. And we approached this implementation of the intervention with a series of training and professional development activities aimed at the teachers that deliver preschool education in the participating centers that we worked in. That intervention, which went on over a period of several years, resulted in a publication that reported that we did succeed in increasing moderate vigorous physical activity. This is expressed here as minutes per hour of observation. That's while the kids were in the child care centers where the intervention had been implemented. So we felt like there was sufficient success here that we'd learned some things that were worth trying to disseminate and establish more broadly. And so toward the end of that project, we got a little practice with the dissemination by delivering the intervention to the centers that were the control group in the study, and found that the intervention was well received by the professionals in those schools. But we knew that if the approaches that we'd learned about in the SHAPE study were going to be widely taken up, that we wouldn't be able to, directly connect in person with large numbers of preschool staff teams. So we pursued funding and were able to receive it to develop an online professional development program that took the key learnings from SHAPES and packaged it in an online program. So the goal was to train early childhood educators to help kids be more active throughout the day. And in the first phase of this work, we really kind of went back to ground zero and did focus groups and talked with a lot of preschool educators about how they do professional development learning, and how they thought we could be most successful in working with them in an online initiative. We developed an online program, a draft program tested it in 5 centers where it was online only, and then in 5 where there was an online plus in-person contact. We really didn't see much difference between the two. People seemed to do fine with the online only approach. And then we tested, kind of an updated version of the online program more broadly in 30 preschools in our state here in South Carolina, and certainly learned a lot from that experience. So at that point, we thought we had something that was valuable. It's 6 online training modules that really took the key learnings from the SHAPE study and packaged them into an online learning system. And the final product, we think, is grounded in theory and based on our research, and it certainly had been field tested and well received. We've had lots of nice comments about the project by the teachers that we've worked with. And so the final step has been to try to take this to a greater reach, broader application, and with support from a foundation here in South Carolina, we've for the last 2+ years, we got 1 more year to go, we've been disseminating this program to preschool staff members across our state here in South Carolina, and we've had a very good reception. And our goal was to deliver the online program to 450 preschool or child care center teachers across 3 years. And we're about 2/3 of the way through this, and we've been evaluating as we've gone along. And the findings thus far have been positive, and we're about on track to reach, I think, our goal in terms of the number of centers and number of teachers that we set off. And I am encouraged that participation in the program has increased across the years, and we think that that's in part a result of the positive response that teachers have had to the program. So with that, thank you very much for your attention, and at this point I'll be delighted to respond to questions. So thank you all very much for your participation today.
Great, thank you, Dr. Pate. We have some questions that we'll take here. One of the questions is, how can we focus on active transportation to improve physical activity if the security in the United States in general is an issue that affects it directly? So in communities where safety is a concern, how can we begin to focus on active transportation?
Yes, thank you for that question, and it's one that I do get frequently, and it's a reasonable question. I approach this really from two perspectives. One is the concerns about safety that are real, meaning that in certainly in some communities, in some neighborhoods, the risks are real, and there I think. I'm not comfortable saying that kids should just be turned loose, or should walk or ride bike to school if there's, objective evidence that it's unsafe for them to do it. In those communities, I think we need to do 2 things at the same time: work to address the safety concerns, the risks, and provide alternative opportunities for kids to be physically active. But I don't think we can just say we can't deal with it. We have to deal with it. Kids need activity to be healthy, to learn properly, and so in those settings, I think we have to take special approaches. It's also true that millions and millions of kids in this country live in environments where it is safe for them to be out, and in this example, to get to school by active means. And, there I think the problem really is not safety. It may be a perception that there's a safety problem. And it may be that, there's just been a shift in the social norm such that, active transport to school is just no longer the normal expectation that it once was in our society. There I think it's parent education. I think it's special initiatives that are aimed at, comforting parents that it will be safe. There are approaches like, walking school buses and things of that sort, where parents are, are in a supervisory role while the kids get to school. There's some reasonably tried and true approaches here that I think we can use, but it's, in my mind, it's really two things. One is a perception that there's a safety problem. Sometimes when that's really not warranted by the data. And then there are the real safety problems where I think we have to take special steps to ensure that kids are getting activity, even though the specific environment may not be safe for them.
Great, thank you. Another question is, it appears that the preschool teachers are getting great activity as well. Are you able to follow their health or physical activity levels across your studies as you're tracking this in the kids?
Yeah, that's a great question. We have not systematically measured physical activity in the teachers that we've worked with, but we do extensive process evaluation in our studies, and that does include standardized and frequent communication with the teachers that we work with. And we have found through our process evaluation work with the teachers that they absolutely personalize this experience to their own physical activity. And so we've learned over the years to begin early in our work with them, talking about their own activity as well as that of the kids that they work with. So while we have not directly measured their activity, we certainly do monitor how they personally feel about activity. And many of them, when we debrief with them, the first thing they want to talk about is how this has affected their own physical activity. So, we do think that part of the positive influence has been on the teachers themselves.
Great, thank you. So what are some of the primary barriers that you're facing when you're trying to initiate some of these programs in these different settings, whether it be the school or the neighborhoods?
Yeah, it tends to be some of the barriers are common across these settings, and some of them are unique to the setting. I think one of our biggest challenges is just inertia. We're looking at changing practices of professional persons. We're talking about making institutional changes. We're talking about making changes in communities where policymakers, city councils, county councils, state legislatures have to adopt new policies. So I think a lot of the work here is really just kind of overcoming inertia. In some settings, the barriers are quite specific to the setting. I mean, we've already talked here about the safety concerns that apply when getting kids outside more often. But inside the school setting, often a barrier is just the sense that if kids are more active, that may take more of the school day than teachers or principals are comfortable with. We certainly think that the evidence supports an overall positive impact on kids and their learning when they become more active. In the clinical situation, I pointed out that there's not a lot of clinic time available, but so we have to overcome that barrier with very time efficient approaches that can realistically be implemented in those settings. Sometimes it's resources. Public health isn't free. There are times when we do have to invest more to get the outcomes that we want. But very often, I think in this field, public health promotion of physical activity, what's needed more than anything is a reallocation of resources, not necessarily a lot of new money. It's really just spend the money a little differently, reallocate the resource, and we think we can produce a lot of positive outcomes.
Great, thank you. This this viewer is asking, with younger kids getting more into social media and technology, how can we make physical activity both enjoyable and sustainable as the kids get older going into middle school and high school? It seems that the older the kids get, the less and less likely they are to want to participate in things like PE class in high school.
Well, that is the big question, you know, and you know, I do often say I think we're in some ways swimming upstream. I mean, we've learned a lot about how to do this. I've tried to summarize, you know, some of that today, but you know, it's not a static playing field. You know, the barriers and distractors to physical activity change over time, and you know, I think in some ways expand over time. So it's you know, I mean, just take social media, okay? You know, that didn't amount to much 10 years ago, and now it's a huge influence in our society. So, I think the hope is that over time we will be able to learn how to make use of some of these you know, new developments that in our society that maybe at least initially are barriers to physical activity, and figure out how to use them to promote physical activity. And there certainly are a lot of people around the country now that are studying, you know, technology-oriented promotion of physical activity. And you know, I personally think it's a little early to draw conclusions about that work, but you know, I do hope that you know that we'll be able to learn some effective approaches using technology to promote physical activity. You know, at the same time, I think you know, we are going to have to figure out how we can institutionalize some changes like those that I've spoken about today. You know, on the premise that if we want a lot more kids to be physically active, we're going to have them spending more time in settings where if they're there, they're almost certainly going to be physically active. And part of that will be to make sure that they're not overexposed to, you know, distracting electronic devices while they're in those settings. So, I mean, an example would be after-school programs. You know, let's have those programs operate in a way that almost guarantees that kids who are there will be physically active, and let's not, you know, have overexposure in those settings to you know, to screens and electronic entertainment.
Great, thank you. I want to point out to folks that what they're seeing on their screen now is some information about the article that Dr. Pate published recently in Exercise and Sports Science Reviews. The unique feature about this particular article is that we have a journal club associated with this. So there are some discussion questions to help you think more critically about Dr. Pate's article. And there's also a visual abstract that lists some resources for parents, educators, healthcare providers, etc. So I encourage you all to go to ESSR and have a look at this article. And as we end, I mean, one final question for Dr. Pate is, within this article, you talk a lot about a systems approach and how it takes a variety of stakeholders and different parties to really move the needle. So can you comment on that briefly as your final thoughts? How a systems approach might be helpful in this situation?
Well, hey, let me preface my response here by saying that to point out what I did at the end of my presentation, I think we can do this. I think we can be successful, but we shouldn't pretend that it's going to be easy, because physical activity is a complex behavior. You know, people do it in a lot of different settings for a lot of different reasons in a lot of different ways, lots of different modes of activity. And so I don't think there's going to be just a magic bullet here. I think we are going to have to make multiple changes. And I certainly do think it will help if we come at this in a systematic way. Right now, a lot of the great things that are happening in our communities in this area are being led by individual champions that are in those communities, and that's always going to be I think a critical part of the effort. But I do hope that as time goes on that that we will develop at the national, state, and local level coordinated approaches to promoting activity. And in the communities across the country where there has been this coordinated effort, there have been some real successes. So I think there are models out there that we should try to expand on. But I don't think we're going to win this battle with just one strategy. I think it's going to take a coordinated, multi-component approach to addressing the problem. Thank you.
Great. Thank you so much, Dr. Pate. We really appreciate your time today. We thank everyone who joined us remotely. We want to remind you that if you register for today's webinar, in a few days you will receive a link to a recorded version of the webinar in case you want to go back over some of this great information that Dr. Pate presented. And with that, everyone here in the national office is going to give Dr. Pate a round of applause as a thank you, and we'll say goodbye.